Thank you, Mr. Chairman, very much, and thank you for your leadership and for scheduling this hearing on such an important topic. The West Africa Ebola epidemic devastated communities in Guinea, Liberia, and Sierra Leone. The virus sickened more than 28,000 people and claimed the lives of more than 11,300. While new cases of Ebola have been dramatically reduced, Ebola is not over, and the conditions that made it an epidemic persist. Last week, a 30-year-old woman died of the disease in Liberia's capital, and her 5-year-old son has been diagnosed with the same disease. Our thoughts and prayers are with them and all the victims of Ebola, but thoughts and prayers are not enough. We must continue to build up health systems in the most vulnerable places so that we can prevent an even worse epidemic from again rising up to threaten people in Africa and around the world. Through 2014 and much of 2015, people watched with a sense of helpless horror as the Ebola virus seemed to spread unchecked. Doctors and nurses, unable to stem its deadly tide, fell mortally sick themselves. That fear took on a new dimension as Ebola began to spread. In September of 2014, a man checked into a Dallas hospital sick with the disease, and many began to fear that the U.S. would suffer an outbreak as well. Of course, the United States did not have an outbreak, neither did countries in Europe. The U.S. and European citizens are fortunate to have capable health systems that virtually eliminated the risk of an epidemic and saved 80% of those treated, a survival rate far above what anyone previously thought was possible. As Dr. Paul Farmer has explained, we in the developed world have the staff, the stuff, the space, and systems to deal with these things. Guinea, Liberia, and Sierra Leone are not so fortunate. Ebola infections there became a rampant, devastating epidemic. More people got the disease than should have, and more sick people died than should have. Beyond the immediate impact of Ebola, the story became even more tragic as the disease crippled weak health care systems and patients had nowhere to seek treatment for routine medical issues. Infant and maternal mortality rates soared, and the economy of each country was hobbled. Agricultural production was disrupted, and food and work became increasingly scarce. The scale of Ebola's devastation may never be fully known. U.S. leadership under President Obama and the Congress was instrumental in stopping the spread of the disease. Thanks to $5.4 billion in emergency funding to combat Ebola, this type of leadership in the face of our severe threats is not only vital for our national security, but also an essential statement about America's commitment to humanity. Just yesterday, the administration once again demonstrated its commitment to protect the American people and strengthen global health security by temporarily redirecting $589 million from existing Ebola funds to combat the Zika virus, a mosquito-borne infection that has broken out in countries of Latin America and threatens to spread north. In February, the administration asked Congress for an emergency supplemental appropriation of $1.9 billion to fight Zika. We cannot look at a false choice between responding to Zika and continuing to build healthcare systems capable of preventing Ebola from again becoming an epidemic. I applaud the administration for making a good start on Zika. As has often been said, a stitch in time saves 9, but we can't stop there on Zika, and we can't pull out the thread that we and our African partners are using to stitch together health systems capable of preventing Ebola from again becoming an epidemic threat. Congress must act to fight both of these threats or be prepared to answer for the consequences of inaction. On Zika, we must invest all of the resources needed to better understand how this disease is transmitted and the suffering which it causes, including babies born with stunted heads and brains. Zika is spreading rapidly in South and Central America, in Puerto Rico, in the Pacific Islands, and in a small part of Africa. You can see on this startling map, the World Health Organization estimated the virus will infect up to 4 million people by the end of this year, and health officials have warned of the spread of Zika in the United States, where its mosquito host is already endemic. This next map shows just how much of the U.S. is vulnerable to that mosquito and the diseases which it carries. While Zika presents a new challenge that America must face, we cannot become complacent about the gains we have achieved against Ebola. We must build upon the investments made during the epidemic and the wake-up call that it provided to the world. The health of the United States is intricately connected with the health of West Africa, Latin America, and other developed regions. As devastating as Ebola was, it is difficult to contract and relatively easy to trace. The next pandemic may not be so forgiving. Having strong health systems in place in vulnerable parts of the world will be crucial to isolate and stamp out the next inevitable threat. I want to thank each of our distinguished witnesses for being here today. All of your leadership and sacrifice in the face of the Ebola epidemic is nothing short of heroic, and we deeply appreciate your service. I should also note that several of you have connections to Massachusetts, and I'm especially grateful that you are representing our great state here today. Thank you, Mr. Chairman.